Welcome, health explorers, to a truly vital journey. Today, we're unlocking the ancient secrets of how nature equips us to fight unseen battles within our bodies. We're talking about powerful botanicals, revered for centuries, that act as your body's personal defense squad against infections, inflammation, and those uncomfortable feelings that tell you something's just not right. Forget the fleeting fads. We're diving into time-tested wisdom, now brilliantly illuminated by modern science. This is part one of our deep dive into nature's invisible shields, where we unveil the profound capabilities of herbs that literally help cool, cleanse, and fortify your system from within. If you're ready to empower yourself with knowledge that transcends generations, go ahead and hit that subscribe button and ring the notification bell, because this is just the beginning of our exploration. Our first incredible ally in this fight is burdock fruit, also known as Niu Bang Zai. This isn't the root you might recognize from your herbal teas. This is the dried, ripe fruit of the Arctium lapa plant, typically collected in the fall from provinces across China like Hebei and Heilongjiang. It's used in its unprocessed form, carrying with it the full essence of its natural power. Traditionally, burdock fruit has been a go-to for what's described as exterior syndromes. Basically, those initial feelings you get when a cold or flu is coming on, especially when there's a feeling of heat or inflammation. It's highly effective in treating febrile diseases, meaning those accompanied by fever, and it's a celebrated remedy for throat infections, like acute pharyngitis and tonsillitis. Think of it as a natural cooling agent that helps soothe inflammation from the outside in. Beyond its role in common viral challenges, its traditional uses extend to powerful antimicrobial actions. Ancient practitioners combined it with other potent herbs to address various skin issues like carbuncles, which are deep skin infections, erythemas or skin redness, mumps, that uncomfortable swelling of the glands, and even acute febrile maculopapular skin rashes, suggesting its broad reach in clearing heat-related skin eruptions. It was also famously used to help relieve and speed the healing of rashes and measles in their early stages, and for other inflammatory skin conditions like erysipelas and various sores. Its traditional profile paints a picture of a versatile cleansing and anti-inflammatory agent, especially for those highly visible, hot conditions. Now, let's look at what modern science has discovered about burdock fruit. Chemical analysis has revealed a rich tapestry of active compounds, including unique lignins like arctiin and arctigenin, which are fascinating plant compounds with diverse biological activities. It also contains thiophene derivatives, sesquiterpenes, triterpenes, polyenic compounds, polysaccharides, and valuable phytosterols. And for a bonus, it's a source of essential fatty acids like arachidonic, stearic, oleic, linoleic, and palmitic acids, along with vitamins A, B, and C. This complex array of constituents helps explain its wide-ranging effects. Modern pharmacological findings impressively corroborate its traditional reputation. Research shows burdock fruit possesses significant antifungal activity in vitro, meaning it can combat fungal growth in lab settings. It's also demonstrated hypoglycemic, blood sugar-lowering properties, which is a fantastic bonus. Furthermore, it acts as a diuretic, helping the body eliminate excess fluids, and importantly, it's an antipyretic, actively reducing fever. Its purgative effect can aid in cleansing the digestive system, and it even shows promise in lowering blood pressure. These modern discoveries illuminate how its ancient use for cooling and cleansing translates into tangible physiological effects, making it a valuable tool in supporting your body's natural defenses. When incorporating burdock fruit into your wellness routine, it's typically prepared as a decoction, a concentrated herbal tea, with a common dosage ranging from 3 to 9 grams. A crucial reminder: this information is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before using any herbal remedies. As with any powerful botanical, certain precautions are important. Individuals with spleen deficiency, often characterized by chronic fatigue, poor digestion, and loose stools, or those experiencing diarrhea, should approach this herb with caution or avoid it. Similarly, if you have what's traditionally known as vital energy and blood deficiency, it's best to steer clear, as its cooling and purgative nature might not be suitable. At its therapeutic doses, classical Chinese texts reported no undesirable side effects or toxicity. which is a testament to its long history of safe use when applied appropriately. Our second extraordinary herb for immune support is gardenia fruit, known as zhai zai. This beautiful, ripe fruit, primarily harvested in provinces like Hunan and Zhejiang, is often dried and used either unprocessed or gently stir-baked to a warm brown color. You might be surprised to learn that traditionally, it was also celebrated for its vibrant hue, used as a natural dye, creating a beautiful yellow color. But its medicinal values run far deeper. In ancient times, gardenia was a go-to for a wide array of conditions, ranging from fevers and fluxes, various discharges to dropsy, fluid retention, lung diseases, and especially jaundice. It was even applied externally as a vulnerary remedy, meaning it aided in wound healing. Its core traditional actions identify it as a potent antipyretic, a fever reducer, a sedative, and a hemostatic agent useful for controlling bleeding, particularly in febrile diseases. It's deeply rooted in the concept of cooling internal heat and calming an agitated system. In the realm of traditional uses, gardenia shines in its ability to relieve intense heat and alleviate dysphoria. This isn't just about physical heat. It's about the kind of agitated restlessness, anxiety, uneasiness, melancholia, and even delirium that can accompany very high fevers or internal imbalances. It helps bring a profound sense of calm to the mind when the body is overwhelmed by internal heat. It's often combined with other cooling herbs to treat conditions like high fever and mental distress due to what's called excessive internal heat. Another crucial role for gardenia is its power to dispel stagnation of pathogenic heat and dampness. This is particularly relevant for conditions like jaundice, where there's a yellowing of the skin and eyes, often accompanied by high fever and scanty, dark urine, which traditionally points to an accumulation of damp heat in the liver and gallbladder. It's also a key ingredient in formulas addressing urinary disturbances such as painful or frequent urination, difficulty urinating, dysuria, dripping of urine, cystitis, and acute urethritis, indicating its ability to clear heat and dampness from the lower urinary tract. Furthermore, gardenia traditionally helps to relieve stagnant liver qi. While we've discussed qi as vital energy, here it refers to smoothing the liver's function and ensuring the free flow of energy, which can become stagnant when there's underlying heat or stress. This helps alleviate symptoms like headaches, dizziness, painful menstruation, discomfort in the sides of the body, red and painful eyes, spontaneous sweating, night sweating, and urinary difficulties. All conditions linked to an agitated or constrained liver in traditional thought. Shifting to modern scientific insights, gardenia's chemical composition is rich in fascinating compounds, notably iridoid glycosides like gardenoside, geniposide, and shangiside, which are believed to be central to its therapeutic actions. It also contains valuable pigments like crostin and crossin, along with gardenin, mannitol, and phytosterols. Pharmacological studies have provided compelling evidence for gardenia's traditional uses. It clearly demonstrates sedative and hypnotic activities, validating its long-standing use for calming anxiety and aiding sleep, especially during febrile states. Its antipyretic effects are also confirmed, reinforcing its role as a fever reducer. Beyond that, it acts as a chalagogue, meaning it actively promotes the flow of bile, which is vital for liver and gallbladder health and detoxification. Intriguingly, it also shows antiparasitic activities and can help lower blood pressure, broadening its impressive spectrum of action. For typical use, gardenia fruit is taken in a decoction, with a recommended dosage of 3 to 10 grams. As always, this information is for educational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease. Please consult with a qualified healthcare professional before starting any new herbal regimen, especially if you have existing health conditions or are taking medications. Regarding precautions, gardenia is traditionally considered unsuitable or should be used with extreme caution by individuals with spleen deficiency, diarrhea, or those experiencing cold in the stomach. This indicates its cool nature, which might exacerbate conditions of coldness or weakness in the digestive system. Classical texts report no undesirable side effects or toxicity at therapeutic doses, highlighting its safety when used appropriately. Our third remarkable plant ally is Phragmites rhizome, known as Lu Gen. This isn't some exotic plant. It's the dried rhizome or underground stem of the common reed, Phragmites communis trin. A plant found virtually everywhere in China, collected throughout the seasons. It's cleaned, dried, and cut into sections for medicinal use. Traditionally, this root is highly regarded as both cooling and diuretic. Its historical uses are quite diverse, including remedies for nausea and vomiting, persistent hiccups, and various fluxes or discharges. Intriguingly, it was historically prized as a poison antidote, particularly recommended for difficulties arising from what was termed choleric diseases, likely referring to conditions with severe gastrointestinal upset and fluid loss and various types of food poisoning, especially from fish, crab, and shrimp. The flowers of this reed were even made into potent decoctions for these types of poisonings, and its ashes were used to stop hemorrhaging. Its traditional profile is that of a powerful cleanser, especially for poisons and for restoring fluid balance. Today, Phragmites is widely used as an antipyretic herb, meaning it effectively reduces fever. It's also valued for its ability to promote the secretion of body fluids, helping to alleviate thirst during febrile conditions and acting as a powerful diuretic, assisting the body in eliminating excess water and toxins. Its detoxicant properties are still highly regarded, particularly for counteracting the effects of fish, crab, and shrimp poisoning, reflecting its ancient reputation. From a traditional perspective, Phragmites excels at relieving heat, promoting fluid secretion, and quenching thirst. For individuals experiencing intense thirst due to acute febrile diseases or conditions involving excess heat in the stomach and lungs, this herb is a key player. It's also traditionally prescribed for pulmonary abscess, a severe lung infection, where it helps to clear heat and support the healing process. Furthermore, it's a primary herb for inducing diuresis, making it invaluable for treating acute urinary infections and painful urination by helping to flush out the urinary tract. Modern scientific investigation has identified several key chemical constituents within Phragmites rhizome, including koixol, asparagine, protein, fat, glucose, and a good complement of vitamins B1, B2, and C. These components contribute to its various therapeutic actions. Pharmacological findings have strongly supported its traditional wisdom. Research confirms its potent diuretic effects, validating its use for fluid balance and urinary health. It also demonstrates clear antiemetic activity, meaning it helps reduce nausea and vomiting, directly aligning with its ancient use for gastrointestinal upset. And critically, studies have shown its effectiveness in treating urinary tract infections, solidifying its role as a natural ally against these common and uncomfortable conditions. This makes Phragmites a truly versatile herb for supporting detoxification and fluid regulation, especially when the body is dealing with internal heat or infections. For a decoction, the typical dosage of dried Phragmites rhizome ranges from 15 to 30 grams. If using the fresh rhizome, the dosage can be increased to 30 to 60 grams. Please remember, this information is for general knowledge and educational purposes only. It is not intended as medical advice. Always consult with a qualified healthcare practitioner or medical doctor before using any herbal remedies, especially if you have a medical condition, are pregnant or breastfeeding, or are taking other medications. In terms of precautions, Phragmites rhizome should be avoided by individuals with spleen deficiency and diarrhea. Its cooling and fluid-moving nature might exacerbate these conditions. Importantly, classical Chinese materia medica reports no undesirable side effects or toxicity at the therapeutic dose, highlighting its gentle yet effective nature when used appropriately. Our fourth remarkable herb in the fight against infection and inflammation is wild chrysanthemum, known as yijuhua. This beautiful, dry flower head, collected in the summer and autumn from various parts of China, is a powerful variant of the more common chrysanthemum used in teas. The medicinal value of chrysanthemum varies significantly by type. While white or yellow chrysanthemums were traditionally used for colds, headaches, and inflamed eyes, even made into soothing pillows for these issues, the wild variety has a particularly potent traditional profile. Historically, it was prepared as a decoction to address retained menses, hinting at its ability to move stagnation. But more notably, it was used as a wash for infected and cancerous sores, and as a fomentation for enlarged glands, showcasing its powerful external anti-inflammatory and cleansing effects. It was even ascribed antivenous properties, suggesting its traditional use in detoxification from alcohol or other internal poisons. Today, wild chrysanthemum is widely recognized as a potent antipyretic, fever-reducing, and anti-inflammatory herb. It's consistently prescribed to clear away heat, detoxify the body, subdue swelling, dissolve lumps, and specifically to treat respiratory infections. It embodies the concept of cooling internal fire and clearing out problematic accumulations. In terms of its traditional applications, wild chrysanthemum is particularly useful against eye inflammations and external infections. It can be used alone in a decoction, or for external infections, the freshly squeezed juice of the flower can be directly applied to the skin. It's frequently combined with other powerful anti-inflammatory and detoxifying herbs for both oral administration and external application to treat various external skin infections, such as furuncles and boils, whether on the surface or deeper in the tissues. It's also a key herb in dispelling wind heat pathogens, which broadly refers to common cold and flu-like symptoms characterized by high fever, coughs, and a sore throat. Here, its cooling properties directly counteract the heat. Furthermore, wild chrysanthemum is traditionally used to reduce liver fire. This doesn't mean your liver is literally on fire, but rather refers to an agitated, overactive state of the liver energy, which can manifest as dizziness, headaches, hypertension, a feeling of fullness in the head, and uncomfortable bloodshot, swollen, and painful eyes. It's a powerful herb for bringing balance and calm to an overactive system. Delving into modern research, the chemical constituents of wild chrysanthemum are quite diverse. Its essential oil contains key components like camphor, along with alpha and beta-pinene, chrysanthemone, camphene, myosin, and limonene. Beyond the essential oil, various sesquiterpene lactones have been identified, such as lactone and cumembrin. Plus, it contains beneficial vitamins A and B. This rich phytochemical profile underlies its wide range of therapeutic effects. Pharmacological findings have provided robust support for wild chrysanthemum's traditional reputation as an infection fighter. It exhibits remarkable antimicrobial activity against a range of pathogens, including Staphylococcus aureus, a common cause of skin infections, Shigella dysenteriae, which causes dysentery, and even some echoviruses, which can cause respiratory and gastrointestinal illnesses. In laboratory settings, decoctions of this herb have been shown to inhibit the growth of Shigella dysenteriae and several other pathogenic bacteria. High concentrations can also inhibit many types of skin fungi. Perhaps most impressively, research indicates that decoctions of wild chrysanthemum can delay pathological alteration in human embryonic kidney or lung cells induced by ECHOII virus, herpes virus, and influenza virus. This suggests a direct antiviral effect at the cellular level. Furthermore, it has been shown to enhance the phagocytic function of human leukocytes, essentially boosting the ability of your white blood cells, your immune system's frontline defenders, to engulf and destroy invaders like Staphylococcus aureus. Beyond its antimicrobial actions, it also helps lower blood pressure in animals and, in human subjects, has shown hypolipemic, cholesterol-lowering effects, increased coronary circulation, and a beneficial role in preventing colds and respiratory diseases. These findings paint a comprehensive picture of a powerful, multifaceted herb for immune and overall health. When using wild chrysanthemum, the typical dosage in a decoction ranges from 9 to 15 grams. For external infections, the fresh wild chrysanthemum juice can be directly applied to the affected areas. As a vital reminder, the information presented here is solely for educational purposes and should not be construed as medical advice. Always consult with a qualified and licensed healthcare professional before making any decisions about your health, especially when considering herbal remedies, to ensure they are safe and appropriate for your individual circumstances. Regarding precautions, individuals with spleen-stomach deficiency and cold conditions should exercise caution or avoid this herb due to its bitter and cold nature, which could potentially exacerbate digestive weaknesses. While the therapeutic dose is considered safe, large doses have occasionally led to mild gastric discomfort, poor appetite, abdominal rumbling, borborygmus, and loose stools in a small number of patients, indicating that moderation and proper dosing are key for optimal benefit and comfort. Our fifth powerful herb in this series is Prunella spike, known as Zia Kukao. This entire plant, including its dried flower spikes, is found mainly in regions like Anhui and Jiangsu, collected in the summer. Traditionally, this herb has been a cornerstone for treating fevers, and it was also valued as an antirheumatic, an alterative, meaning it promotes healthy changes in the body and a general tonic. Prunella spike is widely recognized as an antipyretic, fever-reducing, and a detoxicant. Its actions are often compared to those of chrysanthemum, particularly in its ability to clear heat. However, it's considered even more effective than chrysanthemum for specific eye disorders, especially conjunctivitis. This herb is also famously used for hypertension, for managing inflammation of the lymph nodes, conditions like lymphoid tuberculosis, mastitis, breast inflammation, and scrofula, a form of tuberculosis affecting lymph nodes, and generally as a potent antimicrobial agent. Its traditional scope extends to clearing heat, dispelling stagnation, and resolving problematic masses within the body. In terms of traditional applications, Prunella spike excels at relieving hyperactivity of the liver. This refers to a state of internal agitation or overactivity that can manifest as dizziness, ringing in the ears, blurred vision, hypertension, headaches, and acute conjunctivitis. It's often used in teas or combined with other cooling and liver-supporting herbs to bring balance to an overactive system. Another key traditional role for Prunella spike is its ability to eliminate masses and detoxify. It's a fundamental herb for addressing swollen lymph nodes, mumps, and conditions like goiter, enlargement of the thyroid gland. For breast abscesses and acute mastitis, it can be used alone or in combination with other powerful anti-inflammatory and detoxifying herbs, applied either internally or externally to help resolve swelling and infection. This powerful action on glandular and lymphatic swellings underscores its deep cleansing properties. Now, let's explore its modern scientific validation. Prunella spike contains a rich array of active compounds, including triterpenoids, like ursulic acid and bitulinic acid, flavonoids, such as delphinidine and cyanidin, sterol glycosides, and coumarins. Other significant ingredients include alkaloids, olenolic acid, rutin, hyperoside, caffeic acid, tannin, volatile oil, and important vitamins A, C, and K. This diverse chemical profile accounts for its broad therapeutic spectrum. Pharmacological findings have strongly supported Prunella spike's traditional uses, particularly its impressive antimicrobial properties. It exhibits a rather broad spectrum of activity, especially against bacteria like Shigella spp, Salmonella typhi, E. coli, Pseudomonas aeruginosa, Mycobacterium tuberculosis, and Streptococcus, as well as many pathogenic fungi. Lab studies have specifically shown that decoctions of Prunella spike can inhibit the growth of various bacteria and fungi in vitro. Beyond its direct antimicrobial effects, it's also been shown to cause pronounced contraction of isolated rabbit uteruses, indicating potential effects on smooth muscle. Furthermore, its ethanolic extract has demonstrated hypotensive, blood pressure-lowering activity, reinforcing its traditional use for hypertension. When using Prunella spike, the typical dosage in a decoction ranges from 10 to 15 grams. A crucial and repeated reminder: this content is provided solely for informational and educational purposes. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition, or before starting any new treatment or herbal regimen. Regarding precautions, individuals with spleen and stomach deficiency should use this herb with caution, and those with yang deficiency, a traditional pattern of coldness and lack of vitality, should avoid it. Its cool and somewhat drying nature might not be suitable for these conditions. Importantly, classical texts indicate no undesirable side effects or toxicity at the therapeutic dose, affirming its long history of safe use when applied appropriately. Our sixth and final powerful herb in this Part 1 deep dive is gentiana root, known as long dan cow. This is the root and rhizome of various gentiana species, primarily grown in both northern and southern China, collected in the autumn. Historically, gentiana root was a powerhouse for treating fevers, rheumatism, internal poisons, and conditions of general debility. It was applied to localized skin diseases, ulcers, and afflictions of the throat, highlighting its broad anti-inflammatory and cleansing properties. It was particularly recommended for nocturnal sweating, hematuria, blood in urine, and ophthalmia, eye inflammation, demonstrating its specific affinity for clearing heat from various bodily systems. Today, gentiana root is heralded as a potent antipyretic and detoxicant, with a particular emphasis on its remarkable ability to eliminate intense heat and dampness. in the liver and gallbladder. This makes it a cornerstone in modern traditional practice for treating a wide array of conditions, including acute hepatitis, cystitis, bacterial infections of the eyes, ears, and throat, urinary tract infections, conjunctivitis, and hypertension. From a traditional perspective, gentiana root is unparalleled in its ability to relieve heat and dampness. It's a primary herb for treating jaundice, often combined with other specific herbs to address the yellowing of the skin and other symptoms of liver and gallbladder congestion. It can also be combined to address symptoms like scrotal swelling, perineal itching, painful and sweating testes, and various types of malodorous, yellowish, thick vaginal discharge, all traditionally attributed to the accumulation of damp heat in the lower body. Its most famous traditional application involves relieving intense internal, damp and heat in the liver and gallbladder. This pattern often manifests as severe headaches, hypertension, a feeling of stuffiness and fullness in the head, pain in the side, hypochondriac region, a bitter taste in the mouth, deafness, ear pain, a sore throat, and intensely bloodshot, swollen, and painful eyes. Gentiana root is a critical ingredient in complex formulas designed to powerfully clear this type of deep-seated internal heat and inflammation, restoring balance and comfort. Delving into modern scientific understanding, gentiana root contains powerful bitter principles, primarily sequaridide compounds like gentiopicroside, also known as gentiopicrin, swericide, and amaurogentin. These compounds contribute significantly to its pharmacological actions and its characteristic intense bitterness, which is often linked to its cooling and clearing properties in traditional thought. Pharmacological findings have provided robust scientific validation for gentiana root's ancient reputation. It is confirmed as a broad-spectrum antimicrobial agent, effective against many common pathogenic bacteria, including Pseudomonas aeruginosa, Proteus vulgaris, Salmonella typhi, Staphylococcus aureus, and even certain fungi like Trichophyton gypsum and Nocardia asteroids. This directly supports its traditional use for various infections. Beyond its antimicrobial effects, it acts as a stomachic, meaning it stimulates digestion, increases gastric secretions, and can increase appetite. It's also strongly hepatoprotective, meaning it helps protect the liver, and choletic, actively increasing bile production and flow, which are vital for liver detoxification. Furthermore, compounds within gentiana have been shown to inhibit the central nervous system, exhibiting sedative, muscle relaxant, and antipyretic, fever-reducing effects, helping to lower body temperature. These findings confirm its powerful ability to clear deep-seated heat and support vital organ function. For a decoction, the typical dosage of gentiana root ranges from 3 to 6 grams. A final, critical disclaimer. This content is strictly for informational and educational purposes. It does not provide medical advice and should not be used to self-diagnose or self-treat. Always consult a qualified healthcare professional before incorporating any new herbal remedy, especially if you have a pre-existing medical condition, are pregnant, breastfeeding, or taking any other medications. Overdosing or inappropriate use of any herb can have adverse effects. Regarding precautions, gentiana root is powerful, and people with cold conditions and stomach spleen deficiency should avoid this herb or use it with extreme caution, as its intensely cold and bitter nature can exacerbate these imbalances. It's also crucial to avoid an overdose. While generally safe at therapeutic doses, large or excessive doses may cause gastrointestinal discomfort, impair stomach function, and in some cases, lead to headaches and dizziness. Respecting the dosage and understanding your own body's constitution are paramount for safe and effective use. And with that, our first profound journey into nature's invisible shields concludes. We've uncovered the incredible cleansing power of burdock fruit, the calming and purifying essence of gardenia fruit, the fluid balancing and detoxifying capabilities of Phragmites rhizome, the inflammation-soothing and external protective force of wild chrysanthemum, the lymphatic and eye health guardianship of prunella spike, and the deep heat-clearing and dampness-resolving action of gentiana root. These aren't just ancient stories. They are the validated wisdom of plants, offering powerful, natural ways to support your body's defenses against infection and inflammation. This is merely the beginning of our exploration into the vast, healing world of herbal medicine. If these insights have opened your mind to the incredible power of nature, if you're ready to continue discovering more of these hidden botanical treasures, then please give this video a huge thumbs up, share it with your friends and family, and let me know in the comments below. Which of these infection-fighting herbs resonated most with you? Stay curious, stay informed, and stay vibrant. We'll continue this fascinating journey in part 2.